A surge in melioidosis, a tropical bacterial infection, in far North Queensland has tragically resulted in 2 deaths, prompting urgent warnings from health authorities. The significant spike in cases is strongly suspected to be linked to the recent deluge of heavy rainfall that has characterized the beginning of the wet season. Dr. Jacqueline Murdoch, Director of Tropical Public Health Services in Cairns, highlighted the alarming increase, emphasizing the need for heightened awareness and swift medical attention. Melioidosis, endemic to regions of Queensland and the Northern Territory, is primarily contracted through contact with contaminated soil, though transmission via water or airborne routes is also possible. The bacteria responsible, Burkholderia pseudomallei thrives in moist environments, making the current wet weather conditions a significant contributing factor to the outbreak. The increased prevalence of standing water and saturated soil provides an ideal breeding ground for the bacteria, amplifying the risk of infection. The infection poses a particularly severe threat to individuals with compromised immune systems. Dr. Murdoch specifically urged those with pre-existing conditions, such as diabetes, kidney or lung diseases, or those undergoing cancer treatment, to exercise extreme caution and seek immediate medical attention should they experience any symptoms. Early diagnosis and treatment are crucial in improving the chances of survival and minimizing the risk of severe complications. Symptoms of melioidosis can be varied and nonspecific, making early detection challenging. They can range from mild flu-like symptoms, such as fever, cough, and muscle aches, to more severe manifestations including pneumonia, sepsis, and localized abscesses. The severity of the illness is largely dependent on the individual's overall health and the extent of the infection. The incubation period can vary, ranging from a few days to years, further complicating early diagnosis. The recent deaths underscore the potentially lethal nature of melioidosis, emphasizing the importance of public awareness campaigns and preventative measures. Health authorities are working tirelessly to monitor the outbreak, providing guidance to healthcare professionals and the public alike. Efforts are focused on early detection, appropriate treatment using antibiotics, and minimizing further transmission. The ongoing heavy rainfall necessitates sustained vigilance and a proactive approach to public health, as the risk of melioidosis remains elevated until the wet season concludes and environmental conditions improve. Dr. Murdoch stressed the urgency of the situation, urging residents of far North Queensland to remain informed and take necessary precautions to protect themselves and their families. The public is advised to consult with healthcare providers for any concerns regarding melioidosis symptoms or preventative strategies, especially if they fall into the high-risk categories outlined by Dr. Murdoch. The situation requires ongoing monitoring and a collective effort to mitigate the impact of this significant outbreak.